Hi, I'm Dr. Herb Moskowitz, founder and chairman of ioTech International, and I've been asked on a number of occasions, how did you develop your products? How did the company develop? And I want to share with you the history of ioTech and also the development of our products. And this is actually a very long journey. It started about 35 years ago. And I was practicing dentistry. I was a private practice. And after I had practiced for several years, I became extremely frustrated. I was frustrated because even though by most standards, I had a very successful practice, I had a lot of patients, I was making a lot of money, but I wasn't accomplishing what I had set out to do in developing a practice. What I was trying to do is to help people to keep their teeth for a lifetime. But actually, I turned out to be supervising the neglect of their teeth. I was failing these patients. I had become a dental repairman. So that as their teeth were getting worse and worse and their gums were worsening as well, I was repairing it with each and every visit as I was watching them eventually lose teeth. And it wasn't about what I had set out to accomplish. So in searching for a better way, I came across some very interesting studies. These studies actually compared brushing at home and also flossing. So brushing and flossing at home compared to brushing and rinsing at home. And what I found is that in these really strong studies, that the brushing and rinsing segment had much, much better results. Their gingival health, their gum health were much, much better than those that were brushing and flossing. So brushing and rinsing was much more effective than brushing and flossing, which was a surprise to me because in dental school, it had been drilled into our heads, brush and floss, brush and floss, brush and floss. That was the mantra, and that was what I was repeating to my patients, telling them to do at home each and every day. Nothing wrong with flossing, but as it turns out, a lot of evidence has surfaced showing that brushing and rinsing was even more effective. So when I was looking at what rinses were available at the time, these are the same rinses that had been around for many years. And they had a lot that were not beneficial. A lot of things that were not beneficial with these rinses. Some of them actually were carcinogenic. They stained. Some of them promoted the buildup of calculus, dental tartar. They interfered with the healing of the gums. They tasted lousy, but mainly they were not that effective. So we didn't have the tools or the armamentarium in order to be able to really help dental patients. And the statistics were showing it. More than half the world's population have gum disease. That was true 35 years ago, and it's still true today. So with an army of dentists, with all the products that have come out, we're still in the same boat that we were 35 years ago. So with that in mind, I searched for what I felt would be an ideal antiseptic agent. And that that could be used as a rinse. So in doing so, I looked at some of the things that NASA scientists had done, strangely enough. What do NASA scientists have to do with this? Well, NASA scientists in 1955 were looking for the most effective and best antiseptic agent that they could take on space missions. Why? Because they didn't know what type of microbes they would encounter in outer space. And just like with COVID today, how a new microbial entity can take over the world, in the same sense, that's what they were afraid would happen if they brought back microbes from outer space that we had no defenses for. And therefore, they searched for the very, very strongest, most effective, quickest acting, broadest spectrum antiseptic agents. And what did they come up with? Out of all of their search, they came up with iodine. In addition to that, we know that surgeons around the world scrub with iodine because it's the most effective antiseptic agent as a hand sanitizer. They also use it as a pre-operative skin prep for the same reason. It's the most effective agent. So iodine, amongst all other antiseptic agents, is not only the most effective, but it's also the safest to use. Why? Because iodine, unlike other antiseptic agents, is actually an essential nutrient. If we don't get enough iodine in our diets, we suffer from iodine deficiency diseases. So, with the wonders of iodine, and we focusing on iodine, and I started to explore iodine more seriously, I found that povidone iodine, which is the commonly used iodine in hospitals, medical offices, dental offices, that I was shocked by what was going on in that bottle of iodine. We called it iodine, povidone iodine, but it wasn't just iodine. It was actually a mixture, a dynamic equilibrium of several different species of iodine. And yet, this was the shock. Out of every 10,000 molecules of iodine within povidone iodine, only one of them killed germs. So the rest of those 10,000 molecules didn't do anything to kill germs. It didn't kill any viruses, it didn't kill any bacteria, it didn't kill any fungi. Only the one species, molecular iodine, killed germs. And for every one molecule of molecular iodine, there were 10,000 other molecules of iodine in povidone iodine. That allowed it to stain and also contributed to its toxicity. So the idea then, well, okay, if that's the case, why don't we just put more molecular iodine in and not put as much in of the other iodines? Well, that's easier said than done, because it's a dynamic equilibrium. The molecular iodine is actually unstable. It doesn't stay as molecular iodine. Given the chance, it'll morph into one of the other species of iodine so that it is no longer molecular iodine. So no matter how much more you add, it doesn't stay as molecular iodine. So then the problem became, how do you develop stable solutions of molecular iodine at high levels in order to be able to create a new generation of iodine, a super iodine that could be effective in so many different applications? And the way we did that is that is the way we wanted to do that is the same thing that other researchers for decades have been trying to do but have failed, because it's much easier said than done. But at the time, I was pig-headed enough to think that, well, maybe if we really apply ourselves, we might be able to do it. So I recruited one of the world's leading chemists in iodine chemistry, who had written many textbook chapters on iodine chemistry, and along with another chemist, we set up a laboratory actually in my basement, in my garage in my house, and we spent that was actually the beginning of ioTech International, and we started looking for a way of solving the problem, how to maintain and create solutions of high levels of molecular iodine. So it actually took 3 years in order to be able to do that, and over that 3-year period, there were times that we felt like giving up, but in the long run, after 3 years, we made a major breakthrough, and that breakthrough allowed for the stabilization of high levels of molecular iodine in solutions so that we can have shelf-stable solutions which have 2 or more years of shelf life that maintain their performance. And yet at the same time, all the other species of iodine are suppressed so that these other iodine species are only present in trace levels. So with that, we wound up getting patents on our products and our technology in several different countries. We have patents pending in most of the world's industrialized countries. Patents have issued in the United States, and also instead of that little garage that we started working out of, today we produce product in a 10,000 square foot facility here in Florida. Our products are also produced in a 50,000 square foot facility in Texas. And what we're producing is a family of products which are far more effective than any other products of their kind. And we do that all with molecular iodine. And these are really making a difference in patients' lives worldwide. And after 35 years, I'm actually finally accomplishing what I had set out to do in my dental practice, which was to help patients to keep their teeth a lifetime. And as an example of that, I'd like to show you one of our products in particular, ioRinse Ultra. It just had undergone rigorous testing, independent testing, compared to a number of other antiseptic rinses. And the results of that testing was published in a prestigious dental journal, and I'd like to share those results with you now. Okay, so if you look at the table, you'll see you've got on the left-hand side a column of the different antiseptic rinses that were used in the testing. These are all rinses that are commonly used in dental offices today as important antiseptic rinses. So these are professional rinses, and they're all used in dental offices for the treatment of periodontal disease. The top row shows our product, ioRinse Ultra. And ioRinse Ultra was tested under very realistic mouth-like conditions in the presence of fresh human whole saliva. And it's important to test products in the presence of saliva because saliva actually inactivates, it neutralizes most antiseptic rinses. And so to just test a rinse in a laboratory without using human saliva as a challenge provides unrealistic information because it's not representative of what might occur in the mouth. So all of this testing for all of these rinses was done in the presence of fresh human saliva. And what it shows for these two very powerful and dangerous periodontal bacteria that ioRinse Ultra completely inactivated, completely killed all of the all of those bacteria that came in contact with within 30 seconds. So within 30 seconds of rinsing time, those bacteria were completely destroyed. None of the other rinses were able to be completely effective in that same time period. None of them completely destroyed those bacteria. And the second most effective rinse was 28 times less effective than was ioRinse Ultra. And then it just went downhill from there. So it went to hundreds of times less effective, thousands of times less effective, even hundreds of thousands of times less effective. So this represents all of the major antiseptic rinses that are used in dentistry today, and ioRinse Ultra, far, far more effective against periodontal bacteria than is any of the other antiseptic rinses. So with ioRinse Ultra, essentially, you're not just getting a rinse. So even though it is a rinse and we call it a rinse, you're really getting a treatment in a bottle. So this is something which is an important adjunct to dental treatment. So daily use of ioRinse Ultra is a fabulous addition to one's home care. ioRinse Ultra can be purchased either on Amazon or ioTech International's website. And on your screen, you'll see the website address. And it's also available in thousands of fine dental offices throughout the United States. So anyway, that's just one of many of the products in the ioTech family. And but it serves as a good introduction because it's based on a very special technology, and I'm glad that I was part of that journey. So thanks so much for your time.